We currently have recommendations for germline testing for BRCA 1 and 2 mutations for women with epithelial ovarian cancer. Before I tell you what those are, let me just explain what a germline mutation is. What that means is that when you were born, every single cell in your body contained a mutation in this critical gene involved in the repair of DNA called BRCA or BRCA1 or BRCA2. And that gene, unfortunately, places women at risk for breast, ovarian, and some other cancers, but it's also a gene that we can target, which we'll discuss a little bit more later. And so it's a gene that we want to test for when we have patients who carry a diagnosis of epithelial ovarian cancer. The current recommendations right now are that every woman who carries a diagnosis of epithelial ovarian cancer be offered the opportunity to receive testing and hopefully genetic counseling for this and actually some other germline mutations as well. When we identify a patient, a woman who carries a diagnosis of a germline BRCA1 or BRCA2 mutation, that initiates what we call cascade testing. And that means that we offer testing to first and second degree relatives, both men and women, because this mutation isn't sex specific, actually. It's not just a mutation we see in women, it's passed through men and actually can cause male cancers. And so we want to offer testing to any first or second degree relative, and that would be children, sisters, first degree cousins, etc. And the reason that's important is that unfortunately, the person who has the cancer already has the cancer. However, we can actually prevent cancers if we identify that mutation in their children or relatives through enhanced screening, and really more effectively is through prophylactic surgeries that can markedly reduce and almost eliminate, not quite, but almost eliminate the risk of developing ovarian cancer and breast cancer, which are the two most common cancers associated with this genetic mutation in relatives. And so we can create previvors instead of survivors of cancer, and that's really the goal, is to keep patients' families from ever developing, to keep patients' families at risk from ever developing this disease. Once we have offered testing to a woman who has an epithelial ovarian cancer and we have a result, an informative result of a BRCA mutation or no BRCA mutation, then the next step, it's incumbent upon the professional who did the testing to talk to that patient about communicating those results to their family members, which is increasingly difficult in an environment where families are more widespread and maybe people don't know their family as well as they used to. And so it actually becomes a very complicated issue in some circumstances. And so we really discuss this at the time that we counsel patients for testing, the importance of communicating those results, if possible, to family members, because it informs risk for other family members. We often see as physicians the children of women who have a diagnosis of epithelial ovarian cancer are very concerned that they're next, that they're just kind of sitting ducks for this disease, and often they have unindicated procedures at a very young age to remove their ovaries and fallopian tubes, which for someone who carries a risk may be indicated, but for someone who does not, actually has negative impact on their health and survival years down the road. And so accurate communication of test results to family members who want to know the information is incredibly important.